This is Rise. Let's lock in with the goal of changing one life at a time. Yours. Together, let us rise up, inspire, strengthen, and elevate our minds. It's time to rise on the voice of Nassau Community College, 90.3 WHPC.
Hello, my name is Dr. Saran Heron, and welcome to Rise. Today we are going to talk about poor choices, addictions, and how to overcome and rise above them all. Dr. Adriana Popescu is a clinical psychologist, empowerment coach, speaker, author, and podcast host with 25 years of experience in the mental health field. She specializes in treating addictions and trauma, has directed a number of treatment programs in the San Francisco Bay Area. She is the founder and CEO of Firebird Healing, a trauma healing program, and a clinical director at Avery Lane, a holistic treatment program for women with co-occurring disorders and trauma. She has a private practice in San Francisco and travels around facilitating transformational workshops. She's also a host of a fascinating podcast called Kaleidoscopes of Possibilities, Alternative Perspectives on Mental Health. She loves to empower people to release their self-judgments, overcome their imagined limitations, create a life of infinite possibilities, and rise above poor choices such as addiction. Dr. Adriana Popescu, welcome to Rise here on the voice of Nassau Community College, 90.3 WHPC.
Thanks so much for having me today, Sarah, and I'm happy to be here.
Wonderful. Now, why did you decide to specialize in adult trauma and addiction?
Well, I think because I had seen and experienced so much of it growing up, certainly had my own traumatic experiences. As I got older, a lot of my good friends and people that I cared about were becoming increasingly more addicted to drugs and alcohol and other kinds of behaviors. So when it came time in grad school to look at specializing in something, I wanted to try working in addiction treatment. I found I really loved it. Addiction and trauma kind of go hand in hand. Right. So I became a trauma expert as I became an addiction treatment expert, and here we are.
Right now today, right? Now you had your own traumatic experiences, as you mentioned earlier. You suffered from Lyme disease and chronic fatigue syndrome. Speak to us about those conditions.
Yeah, it was really a rough journey at a time when Western medicine didn't even really know much about Lyme disease. Certainly, doctors didn't know about diagnosing it or treating it. And so it took actually 13 years. I was dealing with this for about 20 years total, and it took 13 years just to get the correct diagnosis. And honestly, there really wasn't a lot at that stage. This was in the 90s, early 2000s. That they didn't have anything to offer me but a PICC line with antibiotics, and I wasn't going to do that. So that really began me on a path of seeking alternative therapies. I went into holistic work, starting with chiropractic, acupuncture, and then it just evolved from there into energy medicine and homeopathy, herbs from South America, from the jungles of South America. I mean, all different kinds of things that were part of my healing journey. And I was able to heal myself from Lyme disease, something that supposedly we're not supposed to be able to do.
Wow, that is amazing. Now, any traumatic experience obviously is not easy. What gave you the strength on those days when you felt like this was too much?
Yeah, well, and those days still happen sometimes, right? In some form or another.
Right.
And I think it's the knowing that at this stage of things, it's the knowing that I can get through it, the knowing that I have come through so much in the past, and that I have tools now that no matter what challenges or difficulties come my way, I have the tools and the support that I need to get through it. And so I don't live in fear of those things anymore. I know that a bad day or week or month will pass. Right. And I know that actually I can use tools to help it pass a little quicker.
I think that's the most important, having the correct tools to help you. Now, having an addiction can be very devastating for some, and maybe even our college students that may be listening today or other audience. What advice from your experience can you share
Well, and it's really hard. I would say for the college age kids in particular, young adults, it can be really difficult to take an honest look at your drinking or using drugs or whatever it is you're getting involved with, because everyone your age is doing it, right? And so it can be really hard to take a look and say, well, am I doing this in a way that's actually hurting me? Or is it interfering with my life in some way, my studies, my health? But I think the first thing to do is that very thing, is to be honest with yourself about, is this something that is supporting me in my life? Is it expanding my life? Is it a positive influence in my life? Or is it actually starting to create problems and making me feel worse about myself, or making me sick in some kind of way, or putting me in dangerous situations? First, you got to be honest with yourself. And then if you think there might be a problem, I would say the next thing might be to speak with a professional, like a therapist, and talk with someone who knows more about it and see, am I somebody who might be starting to develop an addiction, and go from there.
Absolutely. Now, healing others is your passion, and you want others to know that there is a light at the end of the tunnel. Share some steps that individuals should begin to do proactively to overcome these serious addiction problems.
Well, like I said, first an honest inventory with yourself, and then seeking out support. It's really difficult to quit any kind of addictive behavior on your own. So whether that's something like peer support groups like AA, NA, all those 12-step kinds, and there are many other kinds besides 12-step that are out there.
Right.
It might mean working with a professional like a therapist. It might be going to a program like a rehab program or an outpatient program. It really kind of depends on what it is you've been using. If we're talking drugs and alcohol, what you've been using, how much, what's the negative impact. And there are professionals who can help you figure out. We have systems that allow us to assess somebody and find out what level of care is going to be most appropriate for where they're at.
Now, many people may have misconceptions regarding individuals that may require treatment. Like, for example, if you have been treating people who are professionals who suffer from mental illness, which may, have resulted obviously in some form of addiction. Speak to us about that.
Well, it's interesting. Sometimes therapists are like the worst, the worst agents, because a lot of times, we think, I've got to be there for as healers, as caregivers, I've got to be there for my clients. I have to keep going. And we don't often practice what we preach sometimes with self-care. Mm-hmm. And so I have seen a lot of professionals, and not just obviously in mental health, but in many fields, I've seen many professionals get themselves into trouble when they do have maybe an undiagnosed or untreated depression or unresolved trauma from their past, or anxiety that just starts to cripple them and really interfere with their functioning. Sometimes we can't tell when it's crossed a line from something I can manage to something I can't manage. And then a lot of people, when their mental health's not being managed, they may try to self-medicate with drugs and alcohol as a way to keep going.
Now, like anything else, it's important that individuals heal first, which involves, like you mentioned before, looking at the real cause of their issues. How challenging is that for you at times with even your clients that you may serve today?
I really love going for the root cause of things. So I actually feel like this is a strength of mine. And it helps to, I do this work called conscious recovery, specific for addiction, which is very much focused on three specific underlying issues that are really kind of the root cause of addiction. And that is unresolved trauma, toxic shame, and spiritual disconnection. And when we look at things from that angle, it's often really easy to discover what is the thing that's actually driving the addictive behavior. Because it's not the drugs and alcohol or the behavior itself. Those are a symptom of something else. And if you can get to what the something else is and start creating some changes there, and it might be core false beliefs, people believing these terrible things about themselves. I'm not enough. I don't deserve to be happy. I'm a bad person. Well, if you believe that, of course, you're going to create all kinds of circumstances in your life to prove that it's true. But if you can help someone see that your belief in yourself is maybe what's causing some of this dysfunctional behavior,
Right. Mm-hmm.
and we can start to change that, then the healing process can begin.
Right, you got to really be truthful to yourself. Now, you believe anyone could heal once they want to, and it's important to put in the work. How do you encourage your clients who are unable to see the light that you are seeing?
And it can be tough sometimes. That's where I think the group support is so important, right? In rehab, it's group therapy, or even in my own practice, I have support groups, or maybe it's like listening to other people's stories, listening to podcasts, or famous people, celebrities who are in recovery and sharing their stories. It's really important to hear other people's success stories, because of course those can be inspiring. And then we also have tools to work with the fears and doubts. When someone's in that space of, I can't see the light at the end of the tunnel, I'm afraid of facing my trauma, we actually have tools that can address those fears and doubts so that we can pave the way for that light to start to shine.
You are listening to Rise on the Voice of Nassau Community College 90.3 WHPC. My name is Dr. Saran Heron, and today we're talking with Dr. Adriana Popescu, who's a clinical psychologist, empowerment coach, speaker, author, and podcast host with 25 years of experience in the mental health field. She specializes in treating addictions and trauma, has directed a number of treatment programs in San Francisco Bay Area. She is the founder and CEO of Firebird Healing, a trauma healing program, and the clinical director at Avery Lane, a holistic treatment program for women with co-occurring disorders and trauma. She has a private practice in San Francisco and travels around facilitating transformational workshops. She also hosts a fascinating podcast called Kaleidoscopes of Possibilities, Alternative Perspectives on Mental Health. She loves to empower people to release their self-judgments, overcome their imagined limitations, create a life of infinite possibilities, and rise above poor choices such as addiction. Now, your mission is to empower others, which you have been doing with all your excellent work. You give your time. What support do you offer individuals that are at your center? I know earlier you talked about group therapy and having them sharing, stories, so that they could obviously see that there's other people suffering from the same things that they may be suffering. But what other things are you doing at your center that is very impactful for your patients or clients that you treat?
Yeah, so in my group practice, Firebird Healing, because we specialize in treating trauma and quite a bit of addiction as well, we do a lot of individual therapy, and that's where we're able to take the deeper dive, right, into those root causes of people's addiction. We're able to take unresolved trauma, and we use a lot of holistic mind-body techniques, like come from energy psychology, something called brain spotting, which came from EMDR. We use some of these really innovative techniques that have been shown, that are now evidence-based practices that can allow us to access where we've locked trauma in the body and to release it. We also sometimes we might do energy work directly with the body to assist in that. It isn't always verbal processing, which is great, because some people's traumas happen before they could even speak. Right? Trauma can happen even in the womb.
That's true.
So we're able to access those locked up traumas in the body and help them to release. We do have support groups. I run a group, for example, Monday evenings called From Survival to Thrival, which is for people who have done some work on their trauma, but they're still kind of stuck in that victim kind of mentality and in more disempowered state. So we're really looking at, how do you actually create that life that you want, truly be like that firebird rising from the ashes of your trauma and flying free. So we have a lot of different support groups, and we have certainly the individual sessions, and we've done some workshops. We're looking at creating some healing retreats. So a whole bunch of stuff to come. It's a newer business. So I'm really excited to grow it and expand it.
It sounds exciting. Lots of great plans Congratulations on that. Now, Dr. Adriana, part of what you do is you help individuals release themselves from self-judgment. Speak to me about that. How do you help one to release themselves? Because obviously, people may blame themselves that I'm the reason why, and maybe it's not totally their fault. But how do you help them with that? Speak to me about that.
Yeah, I mean, this is a big cornerstone of the work that I do, is working with these core false beliefs. Because, when you look at it, especially from the more spiritual perspective, and you look in the eyes of a baby or a small child, right? You would never look at that child and say they're broken, they're defective, they're not enough, they're stupid, whatever. Unless you're abusive, you would not be saying those things. So that is our essence. I'm functioning from this perspective of your essence, your spirit is whole and perfect. You come into this world that way and you learn these beliefs, lies essentially about yourself, usually from your family, from school, these days, social media,
right? Absolutely.
The movies, right? All that stuff. We're getting these messages all the time about you're not okay unless you're like this. It's not okay to be different. And so then we start to doubt ourselves and we start to disconnect with that sense of wholeness. And we learn to believe things like, I'm a bad person, I am not enough. And then that forms our whole life and the limitations in our life. So I wrote this book called What If You're Not As Effed Up As You Think You Are, where I really look at how we come to believe these lies about ourselves and then look at all the different techniques we have, from traditional psychology to these more Eastern influenced energy psychologies and access consciousness and all the things, and give people tools on how we can change the way we are seeing ourselves. Because there are a million different tools we can use to change these beliefs that we have that are judgments, right. Essentially.
Absolutely. Those listening that are inspired to get help, and what you want to say to them about overcoming addiction, whether alcohol or drugs, and living a better life, what would you say to them if you had a moment to just speak to those people?
I think please do not give up hope that it's possible to change. Absolutely. And even if you don't know where to start, there are lots of people out there who do. And so reach out for support, go on the AA website. They'll have quizzes on a lot of these 12-step websites. We'll actually have a little quiz on, am I an alcoholic? Am I codependent? And start there. And reach out for support from others who have been through what you've been through. Talk to a professional if you need to. See a doctor or a psychiatrist in the event that there's medications. Nowadays we have medication-assisted therapy for not just opiate dependence, but for alcohol dependence as well. There are a lot of medicines that can really help people. There's the whole burgeoning psychedelic, assisted therapy movement. I definitely would say work with some experts in that area if you're interested. That's not something to tread lightly into, but it does hold the promise for some really powerful healing. But really, recognize that it's awfully hard to do it on your own, and reach out for help and support from others.
Excellent advice. Now, you've written books, like you mentioned, about how to empower people. What is your inspiration behind the books?
I think I wanted to just reach a broader audience. Magic and miracles happen every day in my office and in the sessions and at the rehab, and I love that, but it's still small scale. So I wanted to get, the reason I started a podcast, the reason I'm speaking with you, the reason I wrote these books is to reach a larger audience, because look at the world that we're living in. We're living on this insane world where there's so much anger and hatred and polarity, and so much of it is coming from judgment. Judgment of ourselves, judgment of others. And I would just my vision is to live in a happier world where people are kinder to each other, but it's got to start from within. If you're unkind to yourself, you don't have the ability to be kind to others. So that was really my inspiration. And the pandemic kind of gave me the
drive, the push,
and the time to do, to start writing. Yeah. I've collaborated on other book projects, but this book was my first solo. And I got a second in the works on EFT for addiction. So stay tuned for that.
Wonderful. Seems like you're doing great things. Now, our beliefs obviously influence our decisions. Speak to us about the connection as it pertains to one's belief and your belief.
Well, your point of view creates your reality, right? Your beliefs are the cornerstone of what you will create. And if you look at like things like the law of attraction, what you believe to be true will be what you will attract, right? So I'm in the space now where I have done so much work on myself over the last 25 years that I know that infinite possibilities are available. So I try to stay very much in that space and hopefully inspire and invite my clients to use some of the things that worked for me or that I know have worked for other clients and other people I know to start changing these fundamental, they're like the programs of a computer, right? Like you've got some outdated, glitchy programs that are running your life, and we now have the technology to change it. So maybe it's time for an upgrade.
Let's do it instead of talking about it.
Yeah.
So those who are getting help, believe they could still reach their full potential. How so? Do you have them, make them believe that you could really reach your full potential, like you could recover, you could be released from addiction, you could be a better person, better version of you, so to speak. How do you help your clients to really start believing that?
Well, I don't know if I can make anyone believe anything, right? But I certainly can share stories and I can share my experiences. And I think what ends up happening is people start to see the small changes, right?
Absolutely.
They come into my office feeling really, really bad or come onto a Zoom call, whatever. They feel really, really bad. And by the end of the session, they feel a little bit better. And then the next time we meet, same thing. They start to feel a little bit better. And over time, what you start to see happening is those subtle shifts start to become bigger shifts and the person seems less anxious. And sometimes it can happen in one session. You've done some really powerful work. You've done a really powerful brain spotting session and suddenly they're not so anxious or depressed or traumatized as they were. And then sometimes it can happen in a moment, like a miracle. And sometimes it's just the consistent hard work, the chipping away at it week after week, day after day. And then after a while, you look back and you're like, wow, this person's come such a long way. That's how.
Great. Now you are listening to Rise on the Voice of Nassau Community College 90.3 WHPC. My name is Dr. Saran Heron, and today we're talking with Dr. Adriana Popescu, who's a clinical psychologist, empowerment coach, speaker, author, and podcast host for 25 years of experience in the mental health field. She specializes in treating addictions and trauma and has directed a number of treatment programs in the San Francisco Bay Area. She's the founder, CEO of Firebird Healing, a trauma healing program, and the clinical director at Avery Lane, a holistic treatment program for women with co-occurring disorders and trauma. She has her private practice in San Francisco and travels around facilitating transformational workshops. She is also the host of a fascinating podcast called Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. She loves to empower people to release their self-judgments, overcome their imagined limitations, create a life of infinite possibilities, and rise above poor choices, such as addiction. Now, you are a provider. What are the common problems that you are seeing in your practice, if you could share with us briefly?
Sure. I mean, obviously, I see a lot of people who've had pretty chronic and severe trauma. It tends to be more in the complex PTSD arena. Certainly a lot of addiction issues, as we've spoken about. But what I'm seeing a lot of post-pandemic, I think, is disconnection, alienation, like loss of meaning and purpose. I think there's a lot of people very lost right now. And still, like, we're seeing the aftermath, right, of what happened during the pandemic. Some people lost jobs, businesses, but there was this level of isolation that I'm not sure a lot of folks have really fully come out of, where, instead of wanting to meet up in person, they'd rather stay at home and watch TV or watch, binge watch shows. I think some people are still in their caves and in their shells, and there's a loneliness and an isolation to that that we have seen an increase in addictive behaviors. Certainly, we're in an epidemic with opiates and other drugs, but I do think that stuff has gotten worse since the pandemic, for sure, with more loneliness, more depression, more suicidality. And I think the statistics all back it up. And for the younger folks in particular, but everybody, social media, the negative impacts of social media have really started to show.
Now, if you were to predict, like you mentioned earlier, the common trends that you're seeing, but if you were to predict what the future will be like 10 years, if individuals don't spend time getting help or healing, getting their life back in order, as we like to say, what would you think from 10 years from now? Are we going to have the same problems? Are they going to be worse? Are they going to be better now that there are people like you who are providing resources in your time and giving, back to people that, I'm here to help you? What do you predict if you had to predict?
I think the people who will seek help and get it and do the work will thrive and prosper, and we'll see a growing movement of folks waking up and wanting to do that. And I think for the folks who don't think they have a problem or who don't want to deal with it and are going to, the reality is addiction is progressive, and mental health issues, when they are untreated, are progressive. And so it's likely for those folks to get a lot worse. And that does concern me for the consequences for their own lives, but also for the world we're living in, because I think we're already seeing that.
I have to agree with you on that. Now, how could listeners connect with you if they wanted to reach out with you or even, talk with you? How could they reach out to you?
Yeah, so I have my own personal website, adrianapopescu.org. And then we have the Firebird website, firebird-healing.com. I'm on all the social media as well. YouTube, we have a YouTube channel. So it's pretty easy to get a hold of me. And the book has its own landing page, whatifyou'renot.com.
Wonderful. Now, if you had to leave one best advice with our listening audience today, what would it be as it pertained to the topic we've been talking about, addiction, poor choices? What's one best piece of advice that you could leave with our listeners?
It's never too late to make a change. And if you find that your life is not where you'd like it to be, you have the power within you, and with the tools and support that's available out there, you truly can change anything in your life that's not working.
Wonderful advice. Now, thank you so much, Dr. Adriana, for being here today. I really appreciate you taking the time out of your busy schedule to speak with us today.
Thanks so much for having me. It's been a pleasure.
I'm Dr. Saran Heron. Those of you who've listened in and heard the various testimonies that Dr. Adriana's personal story, it should give you hope knowing you can and you have the power to get healing. But it's also critical to know it is a journey that you must decide and be committed. Change your thinking, seek the tools and resources that are available in your community to help you. Blessings to you all always. Thank you for listening to this week's edition of Rise, available wherever you listen to podcasts, and always right here on the Voice of Nassau Community College 90.3 WHPC.